Hey everybody. How's everybody doing today? Yeah? Hey, we have a pretty good crowd here in person already. We also have a bunch of people joining us online. So this is an all-day workshop. Closing the door. We're gonna have people kind of trickling in and out as they come in, and same thing online, trickling in and out throughout the day. I'm going to get started just to make sure that we're kind of staying on time and respecting all the folks who are joining us online. So thank you so much for joining us today. My name is Michelle Birkett. Our workshop today is on bias and big data. This has been a fabulous sort of, there's been so much interest in it so quickly. I think all of us have been sort of surprised even of how much passion people have about this. And a wide sort of interest in it from lots of different communities. So today I want to first sort of go through our outline for the day. And so we have it, you picked up a little registration booklet. We have our outline of the day. We're going to try to stick to this, to especially be respectful of the folks online. We've already done our registration, sort of, getting people settled into their seats. And then we are going to be doing a little bit of an intro to the day, a little bit of an orientation of the day, and then also just starting to think about these topics, getting people to think about these topics. We have a lot of folks from diverse areas. We're going to break then and grab a lunch box, and you saw the lunch boxes sort of right along the side, and have you guys grab a lunch, come on back to your seats, and just eat while Yeshi is here. And so that will be, next will be Yeshi from Data for Black Lives. She's joining us this afternoon, from 1:30 to, from 12:30 to 1:30. And then after, we'll be doing about 15-minute Q&A with her. Then we'll be taking another quick break. We'll have some coffee come in, because we know, it's an all-day thing, we need coffee. And then we're going to come back and start just checking in with you guys, seeing how things are going, what things are, interesting to you, what things maybe we haven't started talking about yet. And then we want to start shifting the conversation more specifically into sexual and gender minority issues in the last part of the day. And so we have then two presentations from our wonderful faculty here at the Institute, Lauren Beach and Gregory Phillips. And I'll say more about them in a little bit. And then we're going to be also talking about how can we start including diverse voices into big data, into data science, and think about what is working well, what isn't working well, and how do we start to fix things both broadly, but then also locally here at Northwestern. And where do we go from here? What's next? It is a really important part of the conversation today. And then finally, reception. We have scheduled 4:30 to 6. Apologies to all the folks who are online and joining us and can't be here in person. But I think that'll be a fun part of the day too. Okay, I want to kind of go over a couple of things. So we're using social media to help keep us connected because there's a lot of interest in this, so that was really important to us. So one way we're doing that, we have both a Blue Jeans stream going. So be mindful of what you're saying, because we have a lot of microphones throughout the room. But the lovely thing about that is that folks who are joining us on Blue Jeans will be able to hear your questions, and so it'll feel like they're a lot more engaged than sometimes happens on some of these webinars. We're also live streaming from a cell phone to our Twitter account. So that's up here. If you see a phone hanging out here, that's what that is. It's a lower quality stream, but it's a way of getting more people on, because you're limited at 100 connections on Blue Jeans. So this is a way to sort of get more people involved, and the conversation will live on, which is great. If you have any concerns about, recording or anything like that, come talk to us. But just be mindful that, we're live streaming it, so, this is a bigger conversation than even the room. And then also, if you want to, engage in this conversation, a couple different ways. One is on Twitter. But using the hashtag bias and big data would be great, because then it can really help us track the conversation and keep us all connected together. So we're encouraging that quite a bit. We're also asking folks, continue to use our website as a resource. We have the link here. It's posted off of the ISGM, the Institute's website. And then we're just sort of, we have the program up right now. We have a lot of really interesting resources, both the primer readings that were sent out to you guys, but then also just like folks who are doing this work that we want to like highlight that like, we're not experts in this area. There's a lot of folks who've been doing this work for a long time, and we want to make sure to shout out to them. Yeah, so our website, the other things, we also want folks to really engage with each other. So a couple ways to do that. So here in the room, it'll be pretty easy. We're going to be spending lots of time for Q&A and for comments and questions and things like that. For those, I should mention there's a viewing in Evanston right now that's happening in the Ron, I believe, conference room, hosted by Nico, which is awesome. And we have 20 folks at least, I think, joining us there right now. Probably the easiest way for the folks there to join us and to ask questions will be to email our connect@northwestern.edu email address. And then after that, so the folks joining us remotely, we're saying, if you are on the live stream on Twitter, probably the best way would be to email that email address. If you're on Blue Jeans, you can message the moderator. What's the name of the moderator? I think it's Connect Moderator. Connect Moderator. So Connect Moderator will come up to Dylan here, and so Dylan will help to field questions that might be coming in from our Blue Jeans stream. Any questions so far from folks in the room about that? Okay. Also, we have some ground rules. Okay, so we think this is super important. When we're talking about these kind of issues, it's hard. It's really hard, and it can bring up some stuff. And also, I'm a psychologist by training too, so it's going to have a little bit of that psychologist kind of feeling. But be mindful of your participation. Okay, so what that means is, so just understand that you probably are coming with certain positions of power. Some people more than others. And just be mindful of that and don't abuse that power and just try to make sure that everybody's voice is being heard. So that goes to number 2, make space. We want this conversation to include as many voices as possible. Take the space that you need to participate in the conversation, but make space for others as well. And then respect for lived experiences. So the lived experiences of people in this room matter. Discussing bias, discrimination can be triggering, and we want to be committed to having an engaging conversation and discussion that's respectful and affirming. So, just be mindful of these things. I also want to give a huge shout out to our co-sponsors who have been amazing in making sure that this happens and allowing us the resources. Work is so fabulous. So the first one I want to, feel free. The first one I really want to highlight is where we're located right now is, we call it ISGEM. It's the Institute of Sexual and Gender Minority Health at Northwestern University. I'm going to read a little blurb to make sure I really get it right. It was founded in 2015. It is the first university-wide institute in the country focused exclusively on research to improve the health of sexual and gender minority communities. They are a leader in research that fosters understanding of the development and experiences of sexual and gender individuals and improves the health and well-being of the SGM. And so this space is nearly entirely dedicated to the Institute. We also have the Center for AIDS Research right here. And it's a great place. We have a lot of different research projects. If you want to learn more about us, please, we have a pamphlets up in front. Francesca Gaiva, the Associate Director, is right in the back and love to talk to you more about the Institute. But they've been wonderful. Another place I really want to highlight is Department of Medical Social Sciences. And so that's the department that my faculty position is based in, and also several of the faculty here. And so specifically within the Health Equity Hub, and they've been great at providing resources. So MSS is an action-oriented hub within the Medical Social Sciences Department to combat inequities in health experienced by specific populations, conducting research to understand how, why, and for whom they arise, and then design and test interventions to address those factors. Our work utilizes social and behavioral science methods together with biomedical science and implementation science to study the multi-level system and contextual factors that influence the health of individuals and groups. So really, we try to be a linkage between the campuses at Northwestern. So if folks aren't familiar, Northwestern has 2 campuses down in Chicago, which is where we're located right now, but then the majority of the university is really up in Evanston. And so we try to be somebody who kind of goes between, the medical school downtown, but then also the social science community much more broadly up in Evanston. Other folks I want to point out, so Center for Health Equity and Transformation was also a very early source of this event. The Center for Health Equity Transformation is about moving beyond a single story and achieving and maintaining health and healthcare delivery. The center serves as a hub within the Institute for Public Health and Medicine and the Lurie Cancer Center to convene, incubate, create, and catalyze innovative clinical care approaches, research, education, and training that will optimize health for all. They're just starting up as a center, but already I think you guys have been doing such good work. So Sarah's here from the chat, would you say? Or would
we do call it chat?
Chat.
That was determined before I started.
Cool.
Thank you.
Yeah, absolutely. And then the last two initiatives are somewhat linked, but also separate. So I want to point out Nico, who has been fabulous in doing both just work that's like extremely interdisciplinary on campus, and they've been such a resource for me since I've gotten here 9 years ago, and even before then. So NICO stands for the Northwestern Institute on Complex Systems. The Northwestern Institute on Complex Systems was founded in 2004 with the goals of uncovering fundamental principles that govern complex systems in science, technology, and human behavior, and applying these principles to solve societally relevant problems through analysis, design, and control of complex systems. So Lewis is here from NICO, and it's just been a fabulous unit to actually really be very interdisciplinary and really try to bring folks together from all these different departments and to have just such interesting conversations. A lot of times utilizing methods that involve data science, but just being very broad. And so it's kind of where creativity, I feel like, happens oftentimes. Some of the most creative talks have come out of there. And then also I want to point out something Luz also leads, which is the Northwestern Data Science Initiative. The Northwestern's Data Science Initiative has its origin in a Lawrence B. Dumas domain dinner titled The Possibilities of Big Data that took place in May 2013. This is one of the best attended domain dinners in the 2-decade history of the program due to such a widespread interest across disciplines and an increasing number of established faculty wanting to participate. The Office of Research funded the Data Science Initiative in the summer of 2015. So that has also been wonderful, especially in the last 2 years. There's been these wonderful lunches that have brought interdisciplinary faculty together to just talk about issues that we have in common, even though coming from very different disciplines. I think like a big theme from today is that it's rare that you really are going to be in a space with people who think very differently from you. So often in universities, we're isolated and we're siloed, and we need spaces like these co-sponsors, to foster ways of us that come together and understand each other's perspectives. Okay, I also want to thank our team. So this is not something that I have done alone by any stretch of the imagination. I especially want to point out the first person on this list, Kate Banner, who just came in. Kate is the project manager with Connect. She holds a master's in global politics, awarded with distinction from the University of Exeter. She's just been wonderful in just organizing everything. So give her a pat on the back today when you see her. I also want to highlight Dylan Feltz, who's right up here. She's a data assistant associate for the Connect and Edit programs. She graduated from Brown University in 2016 with BAs and honors in psychology and literary arts. Our interests broadly include stress and trauma resilience in the LGBTQ community, as well as designing interventions to improve long-term mental and physical health outcomes in sexual and gender minorities. Kate Durdewan is a summer research assistant through the Institute of Policy Research. She just joined us 2 weeks ago. She's fabulous. Wow. Rising sophomore at Northwestern, pursuing a BA in social. I also want to highlight Gregory, Phillips, and Milner, 2 faculty who have also been just so key in having this event happen, and they'll be talking later. First, I want to point out Gregory. He's one of the speakers today. He's an assistant professor in the Department of Medical Sciences and directs the research program and evaluation, data integration, and technical edits. He received his doctorate in epidemiology from the George Washington University in 2012. He spent the last decade working at HRSA, CDC, and NIH funded projects focusing on identifying individuals associated with HIV infection and effective intervention on the halt spread of HIV.
Michelle, can you speak up?
Yes.
You gotta put the microphone on.
Yeah, maybe I should put the mic on. Thank you. Oh, so this one thing. Is that better, guys?
Perfect.
Yes, awesome. Please remind me and others, Jesus, as needed. And then Lauren Beach, I want to also highlight one of our speakers today, research assistant professor, investigates how stigma affects chronic disease management and health outcomes in LGBTQI populations. So she has a big biography, so I don't want to go through all of it, but let's just say she has a JD and a PhD in law, health, and bioethics from the University of Minnesota Law, a PhD in molecular and cellular developmental biology and genetics from the University of Minnesota. She knows everything, and she's not just a researcher, she's also an activist for the bisexual and asexual visibility and a national speaker. She's even spoken at the White House to present recommendations for improving bisexual health outcomes and bisexual data collection methods. So, fabulous, we're very lucky. Pat Janulis has been also so integral in this. He's the associate director of Connect. He's an assistant professor in MSS. He serves as the quantitative methodologist for the center, the Third Coast Center for AIDS Research, and he has his doctorate in community psychology from Michigan State University. And he's focused on similar issues of substance use on HIV, Hep C virus risk behavior, and he's right at the intersection of HIV, drug use, and LGBT health. And finally, I want to highlight Shannon Sotomayor. Shannon is a program assistant at ISGM. She earned her bachelor's in English and Theater Arts from Brown University in 2017. Her broad interests include LGBTQIA+, advocacy, worker rights. She's also a Chicago-based actress and has worked with the Cuckoo's Theater Project, the Women's Theater Alliance, and the Museum of Great Art in Chicago. We have a great team. So, okay, that's like setting the stage for today, guys. Okay, well, that's like intro for today. Now I want to take a little bit of time. I want to kind of warm up you guys a little bit for Yeshi's talk and the rest of our conversation today. And I want to just to start to think through what today's kind of going to look like. So how do we get here? How did this workshop kind of happen, and why are we talking about all this? So I can talk a little bit first, maybe just to start, about the Connect research program that I lead. And so the Connect the full name of it is Complex Systems and Health Disparities Program. Okay, and kind of the common theme across all my work is an interest in using a systems level perspective in understanding how health disparities form. And specifically how they form in marginalized populations, and even more specifically, sexual and gender minorities. Folks kind of at that intersection of multiple different marginalized populations. And sort of what I do is, a lot of folks who do that work don't usually look at it like super quantitatively all the time. And I'm really interested though in how to use quantitative tools to understand how the social, environmental systems differ for those marginalized folks, and how those differences lead to different disparities in health. Understanding why population health is really complicated, and the health of populations, particularly stigmatized populations, it's often not because of anything they're doing within themselves. It's often the result of intersecting individual and relational and environmental processes. And so you need a systems approach to sort of understand what's going on. And it's a very different, it's a shift from like the typical medical model where, X equals Y. That's not the way that this works. This isn't one that focuses on a specific pathway. Instead, it's much more focusing on how the entire system fits together to produce an outcome in a certain condition. So let me also say that sexual and gender minorities are at risk for a number of different health disparities. And just to give you a sense, we have here suicide, homelessness, cancer, HIV, STDs, overweight, obese, victimization, mental health issues, health insurance, tobacco, alcohol. And this is great. In terms of as a researcher, it's great to do work like this, but some of this can be limited sometimes. And you'll hear a little bit more about this, but we don't want to get stuck just here. Like, this is important. We also don't want to get stuck here. And so, we're often trying to think like, well, how do you understand the system? And so I show this picture a lot because I think it kind of helps to explain, like, often what we're seeing when we're looking at, data sets and seeing disparities in health in marginalized folks, we're seeing the after effect of something. Like, what we're seeing is the shadow. But there's a whole bunch of other stuff that it's a lot harder to measure that stuff. It's a lot harder to see. And we need to be creative in how we figure that out and how we're able to show that. If we really want to understand what's going on, if we really want to target interventions and prevention work, they should be targeted. So health is a function of the system. So a lot of what I do is actually, it's very focused on network data. It's very focused on neighborhood data because I'm really interested in like trying to understand the social relationships around people, the sexual relationships around people. A lot of my work is focused in HIV. And so what I end up doing is, when you're trying to understand disparities in health, it's, and especially in MSM, men of sex with men populations, especially racial minority MSM, Black MSM, you really can't be looking just at the individual. So what the stats are here, so this is, these are stats provided by the CDC. So Black young men who have sex with men are particularly affected by the HIV epidemic, with an annual incidence estimated as high as 6.4%, higher than any other age, race, or risk group, by engaging in less sexual and drug risk behaviors. The CDC recently reported that 1 in 2 African American MSM will become HIV positive in their lifetime, versus 1 in 11 white MSM. So, and like when we're looking at why this is happening, it's not because of individual level things. So they're actually participating in less drug use. They're having less sex. They're doing the things right that, like, typically in interventions when we're saying, do this, they're doing those things. But still, we have these disparities. And so we need to start thinking about, like, taking a little bit of a larger perspective, a larger lens. And so here's some data that especially the people in the room will be very familiar. Well, at least this will look familiar to you, I'm sure. So what you're seeing right now is the 2017 rate of HIV infection diagnoses in Chicago by community area. So this is data from the Chicago Department of Public Health. And so what it's showing is the 77 community areas of Chicago. So this is Chicago, split into the 77 community areas. And you're getting a color that determines, the rate of HIV in that particular community area. And what you're seeing is that certain communities are popping out. I could be putting a lot of things on the slide besides HIV. I could be putting obesity, I could be putting cardiovascular risk, I could be putting all kinds of things. Crime, and you're going to see similar. It's the same neighborhoods very often that are affected by this. But if you put race right next to it, and so this is, I should make sure I'm advancing both slides. When you put race of Chicago by neighborhood right next to it, you start to understand things a little bit better. And so what this map is showing is here color of the dot indicates race of a person. And so what you're seeing is, first of all, a lot of racial segregation because you're not seeing a lot of mixing among these different colors. You're seeing them kind of sorting out. And the light blue, purpley color right here is white folks. The green color is African Americans. And then this yellow color is Hispanics. And then you have right down here, Asian, other. And what you're seeing over and again is that the communities that seem to be impacted are, you have three sort of communities, three chunks right here. You have two different chunks that are really focused in the West Side community, majority Black community, and the South Side community, majority Black community. And then you see a blip up here, which is where Boys Town is, which is the SGM LGBT-friendly neighborhood in Chicago. So to understand things like HIV, you really need to understand the larger context of them. I also want to show some other data. So this is very similar. So this is some data that we have. So when we start thinking about networks and we start thinking about, to understand how likely somebody is to get HIV, you need to start understanding the social systems that they're in and the status of their partner. So we measure sexual networks very commonly. And so this is some of our data. And what this is doing is, this is organizing the folks in our study, as well as their sexual partners, all across Chicago. And what it's doing is, it's putting, like, the little dots there are for every neighborhood. So there should be about 77 dots. The size of the dot indicates how many folks were living in that neighborhood. Either they were our participants or they were folks they said that were their sexual partners. And what you're seeing is, if we had a lot of folks, the dot's bigger. And then what you're seeing is the line, that's the sexual partnership. So what you're able to see is sort of the flow of sexual partnerships across neighborhoods. And then the color has to do with HIV. So it's the same color from that last slide, the exact same color. So this is that data organized by latitude and longitude, okay? So when it's, we're spreading people out. It's interesting, you can see, like, there's definitely some connections here. It seems like there's a lot of self-loops. So lots of people in Rogers Park are partnering up with people who also live in Rogers Park, which is kind of interesting. You're definitely seeing some stuff. But what's really interesting is when you take away the constraints, and when you don't make it about latitude and longitude, and this is the same data set, but just organized structurally. So if there's a lot of ties between those neighborhoods, they're close together. If there's less ties, they're farther apart. The weight of that line matters in, like, pulling people together. And so what you're seeing here, you're seeing two separate sort of epidemics in Chicago. Two separate ones that one is, I don't think I included that picture actually, did I? No, I didn't. But what you're seeing here is that this is basically an all African-American part of the network. This is basically all white. And you're seeing Hispanic folks right in between in terms of the majority neighborhood of that. And so these are the kind of things that, if you're just looking at a traditional model that doesn't consider networks or doesn't consider neighborhoods or doesn't try to piece it apart a little bit more, that's going to be invisible. You're not going to be able to see that. If you're really just looking at individual risk behaviors, you're not going to be able to see what race has to do with HIV, what racial segregation might have to do with HIV, what, how these patterns sort of trickle down into our lives over and over again. Yeah, Sarah.
I just wanted to point out for folks in Chicago that there's a film right now at the Siskel Theater called Cooked, and it's all about how your place matters when it comes to health. It was around the 1995 heat wave where 739 folks passed away, and it was majority in South and West Sides. So I didn't mean to interrupt, but I think if people are around, our team went and saw it last night. It's phenomenal, and there's a health equity discussion coming up, I think, on either July 21st or 23rd after the film. But I just wanted to bring it up because it's speaking to exactly what you're talking about, and it starts to get away from the fact that it's like this health or this heat epidemic, but actually what does poverty mean when we're talking about health? And so just a plug that it was really good, and go see it, Cooked.
Thank you. And it's very apropos given that it's 104 degrees heat.
Well, they said that. They were like, what's the irony that today we're talking about this?
And it's like people are very scared about what
a lot of the mapping and things that you're talking about in zip codes and things is what they talk about from a larger social fit into it.
So thanks for bringing it up. That's awesome. So when this is how we got here. Like, in terms of, well, I don't even know if I want to bring this up yet, but I just want to emphasize, this is why we're interested in these issues, is because we know it's so important to measure these other things, like relationships. It's so important to measure things like neighborhood. But our kind of constant concern is the ethics of it, and sort of what also, we know that this data is so important for really showing how these major structural things actually trickle down into our lives. We need the quantitative data to show that. But then there's ethical issues about that. And so how do we grapple with that? And so that's kind of where this conversation comes from, and where our lab's interest comes from,
is in trying to figure this out ourselves of like, how do we do this? How do we do this right? How do we make sure other people who start coming into this work do it right? So another thing I'm going to show is, I've showed like 8 times now, I keep gravitating away until I can really explain it. So this is our website for Network Canvas. So Network Canvas is a project. I just want to give a quick shout out to it and mention. So this is a tool that we've created to collect data on social networks of folks, and to make it very easy, because we have found that there's a high entry bar into getting into social network data capture, especially if you're in health. It's difficult. You don't get this training usually, and so we wanted to create a tool that was easy both for participants, totally easy for them to like be able to share their data, and then also easy for the researcher to simplify a lot of it. So they don't have to know how to code to like make this beautiful visual interface. This is an example of like what it would look like during the data capture process. And so we have like iPads, and like we're drawing pictures, and I think this project is so cool, especially because it's very interdisciplinary. And this all came about from a team that was composed of people from across sociology, psychology, epidemiology, computer science, HCI. Like this is, I think, how like we can come across like really innovative solutions for problems that are existing in the world, where you really have to have an interdisciplinary team to do that. But it's rare to be able to do that and to build those collaborations. It's really tough. So we're very proud of that. Please.
Sorry if I missed this. What were the 2 babies at the
Oh, I can look it up for you. I don't know, honestly, off the top of my head. I'd have to look it up.
I can get it.
I don't remember. I can look it up, though.
Go back.
It doesn't label. I don't have the labels. You just want to... So...
40 and 40.
Mm-hmm.
But I can get it there.
44 and 40. 44 and 40. And they're the same numbers as you can get access to. Mm-hmm. Okay. So I kind of made this point already, but I think that this is so important because increasingly we're trying to tackle these big problems, these big health inequity, health disparities in HIV, health disparities in whatever, these big problems, but we really need to sort of take a shift away from any methods that are just in one discipline. We really need to come across and start figuring out how we can get more folks involved in answering these questions. And I think it's like I said before, it's really hard to do interdisciplinary science. We need multiple different disciplines. But I also think that, I also think that problems aren't solved by either, not even just different disciplines, but different sectors, and so I don't think academia is the place to be solving most of this. And the best work that we've done has been work that's been engaged with the community, and it's been informed by the community. It's been informed by, actual real life experience, but it's also really rare to see that happen. So this is more about Connect and sort of what we try to do. We're trying to support transdisciplinary research collaborations. We're trying to develop and foster methods to collect all this messy, fuzzy data, that's a little different. Social data, geographic data, data on relationships, all that stuff. And anything that we see is like relevant to health, we want to make it easier for folks to do that. And we also want to develop deeper theoretical understandings of stigma and systemic production of health disparities, and try to figure out how can we use this knowledge to understand how to intervene in different ways. So that's us. Let me go over some goals for today, just so you kind of orient us a little bit. Things that I see as really important. I am so glad to see how many different disciplines are represented here. I want to create a space for you all to bridge some boundaries with each other, to get to know each other, to understand other people's perspectives. So there's lots of time built in for you guys to talk, ask questions, and engage. I want to highlight that we have, I kind of mentioned a little bit of this already, we're connecting different campuses. So we have everybody down here, about 50-some people have been registered for our in-person conference room. We also have about 20 folks joining us up in Evanston via the viewing up there. We have, oh, this did something weird with the formatting. We have 100 people who registered online. We maxed out on our Blue Jeans. We also have a Twitter going, which is awesome. So people from all over, really, all over the country. I will also say that we are connecting the campuses. So it's not just Northwestern represented in this room or online. We have 20 different universities who've been registered, which is amazing. And there's also a viewing at Penn State. I just want to do a shout out to Eric Leyland, who set up a viewing at the Penn State Methodology Center, and connecting across different sectors and disciplines. In addition to our academic guests, we're also thrilled to welcome representatives from Chicago's local government bodies, including the Chicago Department of Public Health.
Yes.
CPS, as well as the state of Illinois, and the federal government workers today, such as researchers at the NIH and CDC. We have 10 people registered from the NIH. We have 2 from the CDC. So thank you, and no pressure or anything.
How many from CDPH?
No, right. And I also just want to point out too, so, there's a lot of organizations represented. Of course, we have Yeshi here from Data for Black Lives. I pulled out here of just a few of the places that are represented. Chicago AIDS, the AIDS Foundation of Chicago, the Center in Halstead, TPAN. That's awesome. I'm so glad you guys are here. We want to recognize and welcome folks today who, are from private and activist sectors too, and as well as on-the-ground community people who are taking time out of their busy days to be here. This is just a sample of who's in the room, but I want people to know that, you're in a space that's a little more diverse than maybe you're used to. And also, finally, we want to also highlight the folks who are bringing lived experience to the table. So it's important that you also get people who aren't necessarily a part of these conversations always, who are having real lived experience. So opening the conversation of those outside of traditional academic circles. We need to make the voices of people impacted by big data heard in these rooms where the decisions get made. We're seeking to improve data science so that we can make a tangible impact on people's lives. We have to allow an ethos of justice to guide the work that we do. So, a couple other goals for today. We want to dispel the myth that data is unbiased. Okay, that's important. I have a little activity that we're going to jump through real quick, and but we'll get back to that. But basically, data systems are really powerful, and that who creates and understands those systems holds a lot of power. Goals for today: educate how data systems and automated decision-making can amplify bias. We'll kind of get into that a little bit more later, but these things are not bias-free, and in some cases, when done poorly, they can amplify. Show through numerous examples how already vulnerable people are hurt by data and by data systems. We hope to highlight and amplify the good work that's already being done by a lot of folks in this room. This is just a sample. I'm just going to highlight some of the folks that we've learned a lot by reading and looking and seeing what's out there. We are also going to be putting all these folks on our website eventually when we get a moment. But a couple things just to, I think this is Fair and Transparent Machine Learning, Data for Black Lives. 3 amazing books here: Automating Inequality by Virginia Eubanks, Weapons of Math Destruction by Kathy O'Neill, Algorithms of Oppression by Saifa Noble, the More Than Code Report, which was one of the preliminary sort of reading, lovely report, the AI Now Institute, Algorithmic Justice League, and Data in Society. Just some of the folks who are doing amazing work. And a lot of that community has already sort of talked a lot about gender and Black and brown communities, but one thing that hasn't been touched on as much, and one of the reasons why we specifically wanted this conversation to start talking about sexual and gender minorities, is that we wanted to bring that conversation into this space. We wanted to begin to understand what are the similarities and what are the differences when we start talking about this population, which is a little bit different. This is, this is a population that's vulnerable, but in very differing ways, and this is a population which is in many ways actually fighting for increased representation in data sets. So it's a little different when, but also we need to be mindful of once they're in those data sets, what happens to that data? And then finally, how diverse folks can be brought into data science, both broadly and locally. And last goal, a conversation today and not a lecture. We are not experts. We are figuring it out ourselves. We want to hear your expertise and trying to come together, in some sort of way. Use this space to come to a common understanding. And okay, activity time. Okay. And I think the activity, we're at 11:55 right now. What time did I say this would go to, guys? I'm trying to. Okay, at 20 minutes. Okay. So, super broad question. This is for the people in the room. Hey, you can see if Blue Jeans people can participate too. What's research? What does that even mean? Super broad question. What does that even start to mean? What is research? How do you define research? Yeah?
It's a systematic investigation for generalizable.
Yeah, I think that sounds good. You guys agree with that? Yeah, I think so. I think that's a great, so, there's like this, I keep advancing the wrong slide. There's like this messy world out there, this real life world that we're all in, okay? And then there's somebody who's observing that world and is saying, okay, real messy, I'm going to take a look and observe it, and, I'm going to notice something that maybe there's a problem. Maybe there's something there that I want to understand. So the first thing, what we're going to do is I'm going to try to break this down really systematically into steps, okay? We're going to go through these steps. So first thing, identify a real world problem, okay? What do you think might be the next thing, the next step? And once you do a problem, you see something's there, and just as a hint, this is kind of what everybody thinks research is.
Not what it really is.
Yeah.
Well, I like how you're saying, I hate to be academic, but it's your hypothesis. We're methodologists.
Yeah.
We go by method. That's the difference between us and any one layperson.
Yep.
And we try to do our hypothesis. I don't want to go into all that. Y'all know.
Totally, yes. But you're trying to, you're making it systematic. You're trying to use methods. You're trying to quantify it. You're trying to, and so the way that I put this in this little activity, create some sort of I put mathematical, it's a model. Take a model of whatever it is that you're interested in. You want to take a model of it, and to make it real, you're basically identifying something in the world and then trying to simplify it down into something that you can actually use systematized methods to understand. That sounds about right? We got it on the same page? Okay. And then next step, receive some results, hopefully. Next one, maybe apply a solution back to that community, okay? You guys following that model? Super simple. Real world, identify a real world problem, create some sort of specific sort of model of how that problem works, run it, receive some results, get a solution and apply it, okay? What I want to do now is I kind of want to go through each of these steps and just I want people just to talk about where they're seeing, where does bias enter there, okay? Just to get us warmed up. So in that part of identifying a real world issue, how does bias start to enter that system?
That identification is only from you.
Yeah, and what's wrong with that? When it's one person's perspective, what could be wrong potentially with that? Jessica?
People with more privilege maybe than others that are less privileged.
Yes, absolutely. So a person brings with them their own worldview and could potentially shape what kind of question, what is seen as problematic, what questions kind of get formed. Absolutely.
It's subjective.
Yeah.
Even though we're told it's not subjective.
Absolutely. Other folks have some ideas here of that idea of how does bias enter in this stage potentially? Something different from that?
The person that's asking the question is bringing in their own just lived bias or prejudice.
Absolutely. Yep. Absolutely. Yep.
Funding tends to go to questions about some people.
So I think you said funding tends to go to some researchers more than others, or
No,
researchers in
some types
general?
of questions.
Yes, yeah. I had a couple of notes down here, and one of the ways that I was phrasing it was like, so much of this is like who has the power to ask questions is determined by like who has the resources to ask questions, you know? And that's why funders are so important with this. That's why institutions that do this work are so important to be thinking about these issues, is because are we funding the right work? Are we supporting the right work in these institutions? Because people can't do this kind of stuff alone. It takes, you know, people need money, need to work, and so, but these top level decisions also impact things.
I think the question of when we're talking about what is a problem, the lens by which we're defining what a problem is. And so oftentimes a problem is interrupting something.
Yep.
And depending on that lens, you know, and I think that goes back to kind of what we were talking about with systems and funding and, you know, what fixing something, you know, how we define that and what that really looks like.
Yep. Who gets to define what a problem is? Yep. Yeah.
And the access to knowledge, understand what is a problem. So I may see something in a community that really resonates to me as a problem because where I live or what I have the capacity to form through my education and privilege, the ability to form a thought around that. But if that's your day to day, that doesn't seem problematic to you at times. So I think there's also that component of even just having the knowledge to know to define problems.
Yeah.
Versus the struggle of just getting by your day to day.
Yeah, like some people are privileged to be able to think about, hey, what's a problem and how do I solve it, versus like, I can't think that way, I need to think about today. Yeah.
In terms of bringing up something. Like the report is coming in. Even if you saw the movie, because it goes much more detail about the systematic aspects of what's going on. Able to be accepted as a contributor. And the last observation that I make is the fact that at East and reinforce situations that mean partner change, that something that started from a bias will become blind to the fact that it started from a bias.
Really like his example in which going toward, and that's the circle component often overlooked. It's not it doesn't lead in. It starts with what I think is a problem. But of course, research means go back and reclaim or rehear what was done. So the re part is the searching part that you have to go back to. And sometimes we forget that should have been the lead and not the beginning. But it should be the lead and not your just idea. And I would also offer that the voice. We are getting to where we've been voicing it, but it's not heard or worked on. So I think the voice is as we say, the voice that gets funded is not usually the voice that is impacted.
Yeah. Yes. Okay, you're good at this.
That's why I'm good.
I know, good. We're glad. Okay, let's go to this stage. Okay, so this point where we're really trying to make things really specific. Okay, this is like, again, what people kind of think of as research, and that's why they kind of get scared of it, because they think they might not have, the math training, the research training. This is like the crazy thing that they just won't understand, and so this is sometimes where people get stuck. What are some things here that, like, what trip us up here? Any ideas? There's a lot, I think.
That's one of the innocent, like, need to afford, or the thought of money to programs, private packages to analyze numbers at a high level, and although there's like open sessions
Yeah.
like SurveyMonkey more accessible,
Yeah.
I think people have this idea that it's not
Yeah.
you're not really showing your
Yes.
CIs or conference intervals and all of that if
Yeah.
you don't have stats or whatever. So it's like a very monetary
Yeah.
like access thing that sometimes bias people.
Absolutely. Like science has to be fancy.
Right.
Like science has to be, well, of course you'd have to like do it in R and Python or something, and it have to be reproducible. But the truth is that many of the people who are doing this work don't either have the money to like, R is not a good example because that's open source, but don't have the training, which takes time, it's not easy, which is not standard in many programs, which, and even if you're not, in an academic program, how are you going to learn some of this stuff, I will even speak as a psychologist who had great stats training and considers myself very quantitative.
Great.
I am also like not well versed in this stuff. I feel like I struggle myself because sometimes the methods kind of get so complicated that you really have to like stay on it. And this has to be part, and if you're focused in lots of different domains, like if you're focused on populations, if you're focused on health, it's hard to stay up to date. I think health researchers in particular struggle in this area because they're so passionate about things like populations and health that the method is just a tool to get there. It's not necessarily it's end all be all. Yeah.
A place where activism can be very important in changing. For instance, most school systems are very willing to take stuff from Microsoft or Google,
Yeah.
and that idea is like, oh, aren't those companies so generous? But
Yeah.
what they are creating is a system in which you think those are the tools that you need something. And instead, we should be trying to push for our kids to be using and learning from things that are open source and free, because then they don't have to think that that's the way that you have to do things. And it's a little bit of a poison pill to take these free things that these large corporations are giving you, but then they are setting you on kind of unsustainable path.
I absolutely, it's funny, I also I feel like the hard thing too with this is that the open source community means that folks are doing this out of their own love of it, out of their own love, which means that the documentation, the training materials aren't great sometimes because of that. I mean, I think in scale, they can become great, but oftentimes it takes a little bit of time to reach the users that are more not enmeshed in this. So it's frustrating because I feel like some companies, like you were saying, like Microsoft and some of these companies, they have the resources to make it easy for people, but the problem is down the line, like you're pointing out. Money is to be had at some point later on, and you're kind of stuck in this environment. Yes. Oh yeah, let's go here first. Yeah.
For we're constructing a mathematical model.
Yes.
We're always looking for input. We're looking
Yes.
for data points as input to a mathematical model. The data point can only be a proxy for the world reality. No matter how close we are, it is not a world reality.
Yep.
And that proxy that was chosen is by and large decided by the researcher constructing the model.
Yep.
And this is where bias and prejudice could come into play, because you could be choosing data points that you think reflects the world accurately, when in fact there is inherent injustice within there.
Because what gets measured is also determined by all of these other systems. What's determined, what's deemed important enough to measure, to capture systematically, to have available for people to use. There's a lot that goes into all of those. And so as a researcher, I feel it constantly is like, well, we'll use this. It's not ideal, but this is what we have.
Following up on that, I think that using the term mathematical model privileges the quantitative over the qualitative and the descriptive.
True.
So,
Yep.
as
Absolutely.
a qualitative researcher, I like to just remind us that numbers aren't it, and that tends to bias us.
Yes, excellent.
That's like one of my points, like towards the end, but I absolutely. No. I'm still a pop person, but I like to be one that knows when I'm wrong and that you need to also like use qualitative data too. Yeah, Francesca.
I think academia it has an inherent bias that is built in that amplifies sort of bias. So when we identify a problem and we want to study it, the first thing that we are told is read everything that has been already written.
Yeah.
So, and I think of the example that you gave here, the fact that, HIV infection rates are high among of sex with men in Chicago, even though their individual behaviors are less risky than their white counterparts. And so when we are told to read everything, immediately what we would go to literature that tells us HIV infection is driven by individual behaviors, and so that's where we need to intervene. And that would be the wrong direction to go for this population.
Yep.
I think that it's also important that we name that even the way that we do research and the way that we define it is culturally defined. Like when we talk about, research and quantitative, even qualitative, like we kind of talk about it like, of course we do this, and as though there's no other way of measuring a problem or assessing a problem. And it's not a bad thing. It's just sometimes we say it as though it just is, like it just, and I think it's so important that we recognize that even though these are the environments that we're in, and this is the education that we've received, and the ways in which we've been taught to think, that it's not the only way, and that it's not necessarily, it's not the best way. It's just one. Because if we forget that, then we just kind of think that this is it, and this is the only way to define it. This is the only way to kind of get to that solution part, and we can then inadvertently cause harm to communities that have been doing this work for centuries in a very different way because we think that we have it figured out, Just naming that and kind of always being aware of that, even within the work that we're doing,
Yep. Back off of that, there's a book that's called Research, and it talks about how our research and the way we approach it has been usually connected into a country that has been very traumatized and discriminatory, colonizing, so that we kind of really need to think about the research as a big of the structure and how it has as other structural things to remove. And so I don't know if we're going to do a research list. I know you have one, but a good book is called Decolonizing Research, and it really does speak to what you're saying. It's talking about these other models that sit outside of what is deemed research. To really take a step back and say, hey, there's other ways of doing this.
Michelle, I want to, she said piggy. I'm a vegetarian, so it's veggie back. But, you didn't have to.
No, I'm hot.
Okay.
I don't know you guys. I'm hot.
In a minute, but I want to veggie back because there's a medical ethic. This is called medical apartheid. I'm sure you all have heard of Harriet Washington. She's a colleague of mine, by the way, and one of the things mortuary science was actually started off of robbing the slaves of African and enslaved people. I'm never a slave. I'm an enslaved person. And as an African person, that's how mortuary science got started. It was not called mortuary science. So when people read that, and historically, because she's a medical ethicist, she did the chronological research on this, and even I was taken aback that it was so well known. But it was like, okay, that was okay. I mean, Henrietta Lacks. I mean, we can go down the line. My point is that as you're moving through this part, when you said mathematical model, what the problem is in health is not mathematics. Humans are complex. This is never going to work in our field. Now, maybe insurance and
I would say
sports.
No.
I don't know.
These technical systems, they always butt up against. Always, at some point, even if they're not meant to be on health, but they're there because people need them, and so that means that they're butting up against people some ways. So, yeah. Do I want to go here now? Okay. One thing I wanted to, because we're hitting our time, so I guess I will. So I wanted to just highlight this. Are you guys familiar with this? Seen this before? Some folks. Okay, Louis He knows it? Okay. This is really interesting. So this is, I think, like a really good example of like how really like wonderful methods, lovely methods can be kind of dumb when they're just like not connected to the context. And so you guys have you heard that like, they can predict like what the flu season is going to be like depending on like Google results. So this was like a big thing. There was a science paper that came out. But then what they realized was that the algorithm that was doing it was actually failing after 2 years. It worked for 2 years, and then all of a sudden it got really dumb, and it just like prediction was really bad. And one of the issues is that what the algorithm was doing is and this is what a lot of these automated sort of analytic methods do in these algorithms, that they take the data that they've been given and they determine, okay, I'm trying to look for what in this data determines, and it's going to find something in that data set. And when we're talking about search results, the kinds of things, that people, it might make sense, like, oh, I have the flu, what do I do? Or where's the flu clinic or something like that. But a lot of things that aren't connected to the flu were actually also correlating with this. So like one was, I think the one I highlighted was Google's algorithm was quite vulnerable to overfitting to seasonal terms unrelated to the flu, like high school basketball, like things like that. But that, and then it had such an impact is that then the model just like stopped working like over time. And so this is just one sort of example, though, about how these tools, when they're disconnected from the real world, when they're disconnected from context, they can kind of run awry if we're not paying attention. If there's not, actually, like, are we going back to the data and saying, like, does this make sense? We can't just, like, let these things go. Like, what if, this had worked really well and we had said, okay, we're not going to be doing, we're just going to use Google's algorithm to determine this instead of doing, like, so much epidemiological investigation to understand flu trends in the United States. Where would we be? Like things like that. Like we have to be very careful that when we're giving autonomy to these solutions, that there's some way of like phasing that back into the real world. So one example, I think we can go into a lot here. Let's do it like real quick. What do you think? So like when you're applying solutions, what are some of the issues here? First of all, does the solution ever get applied to the community? Sometimes, not oftentimes, no. And then also I think there's like, if it is applied, how is it being done? How is it being implemented? Is it being implemented fairly? Who is it applied to? And one of the things I wanted to point out, and it's something that's talked about quite a bit in the Automating Inequality, a lovely book with all these different case studies of just like how these data systems have been put on the most vulnerable people. One thing that really happens is that like these data systems, oftentimes they're applied, but then they're applied to the most vulnerable people, and people really lose their autonomy when they are, and they're just at the beckoning of whatever an algorithm sort of puts them in and sorts them. And so, there's a lot there. Let me see. Make sure I covered all the important things. So much. I think we'll get to it throughout the day, and let me just kind of, end some of these slides with this idea of like, this isn't new. Like, this isn't new because of big data. This isn't new because of data science or any of that. But the difference is, like, this has always been an issue. Almost everything we're talking about has always been an issue. But the difference is that we're able to scale these things up, and we're able to, scale them up and amplify them, and in a way, they're also more easily hidden. In some ways, like we like to think of these systems as being very easily interrogatable because they're systems, they're algorithms. But actually, it takes a lot of technical savvy. It takes a lot of authority to be able to critique things like this. And I think it really makes it difficult for people who aren't in that particular silo to be able to understand what's going on and understand why it's not okay and be able to push back against it. I feel like I've seen this so often, even as a paper reviewer, as a grant reviewer, of health researchers who have so much expertise and are so, they have so much training, and in quantitative training too. But like when it comes to some of these things that are just kind of a little bit newer, or they haven't had like the training in, they are very reluctant to criticize it because they don't feel like they have the capacity to. And that's such a shame because we need people with different levels of expertise in all different areas to be able to criticize things like this. And so we can make them better. So I will leave that here for now. So we're going to be doing a 15-minute break now, okay? And so what we're going to be doing during that time, okay, one thing, okay? You guys are going to have to introduce yourself to 2 people that you don't know. And I know, fun. And okay, so you're going to do that in our 15-minute break. Another thing that you're going to do is you're going to pick up a box lunch. They're right outside. Get a drink. Come back to your seat and just we're going to have people eat lunch in here while we get set up with Yeshi. I think I'm missing. Cool. Okay, thanks, you guys.